What happens is when you get strep, the bacteria hides itself in your body by having basically factors on the outside that make it look like other organs in your body. PANDAS, which stands for Pediatric Autoimmune Neuropsychiatric Diagnosis Associated with Strep, a long name, is basically the onset of obsessive-compulsive disorder or tics, or both of them, in children who've developed an infection due to strep. What happens is when you get strep, the bacteria hides itself in your body by having basically factors on the outside that make it look like other organs in your body. At some point, the body figures out, hey, this is an infection, and it makes antibodies to that bacteria. And the antibodies end up attacking the organ that the strep looked like. One of those organs is the brain. So for some kids, probably those that have a family history to some degree of an anxiety disorder or OCD or tics, who are susceptible potentially to this, they may, upon getting a strep infection, go from being perfectly healthy and normal and not having any of these behaviors to suddenly having a big onslaught of either obsessive-compulsive symptoms or tics, which is the repetitive behavior that has no particular purpose but happens many times a day. Or they may have moodiness, they may have hyperactivity. Those are other symptoms that can come along with it. But when you notice suddenly your kid had a sore throat, your kid had a cold of some sort, and suddenly they develop these behaviors, you should think about this kind of infection. You should bring them to the pediatrician and get a strep test.